Hello, and thank you for joining us at Therapy Chat with Phoenix Behavioral Health. I am Dr. Dawn Parks, and with me is Christine DesLauriers, LICSW, and addiction specialist. And today we are going to change a little bit from our usual things that we do to talking about answering some of the questions that we've received either via our website, phoenixinfo.online, or with clients over time or phone calls. And so, in the half hour that we have, we are going to discuss perhaps some of the more common questions that have come up. And one very practical question is, when we're talking about engaging in therapy, what are we talking about as far as payment? How do we manage that? So in general, you want to make sure that your therapist accepts the insurance that you have. So when you call to make an appointment, typically the intake person on the other end will ask you what your insurance is, take down that information. Depending on your insurance, that will determine, how much of a copay that you have, which is usually between anywhere from $10 to perhaps $30 that you would pay at each appointment. You'd also have to consider what's called your deductible. So someone's deductible, let's say you have $500 deductible, then that means that you would be responsible for paying that first $500 for your appointments, and then your insurance would kick in, and they would cover the costs for each appointment, and then you would be responsible for your $10, $15 copay at each session. And again, it does depend on what insurance coverage you have. Same for couples therapy or family therapy. Typically the insurance that offers the best coverage by the client will be used, right? So that would be discussed at the time of the intake. Typically, just give a range here of what an individual one-on-one therapy session would be. The average range is about 100, but that could go from perhaps 85 to 130, 140. But the average is about 100. For an intake session, the average is about 150. For a couples session, typically around 125. So these are just averages. And also, depending on your insurance, the amount of sessions that you have with your therapist under your coverage will be determined. Most insurances, it's just continual. You can take as many sessions as you want, but there are one or two insurances where your therapist would have to ask for an authorization for you to be seen, and you may be given perhaps 12 sessions. So your therapist would have to find what's called medical necessity, right? So this person is dealing with extreme depression, and I'm requesting authorization to see this client. And so then usually that's accepted, and you'd be given 12 sessions. If you wanted to continue, then your therapist would request another 10 or 12 sessions. But in most cases, that doesn't usually happen. It's just ongoing, as many sessions as are needed. Any thoughts about that, Christine?
Well, that sounds about right. I think if you're going to see a psychiatrist, it's probably more expensive. But that's, average between $100 and $200 is probably the range that you're talking about.
Mm-hmm. Yeah. second question.
Yeah, I have a question that we are often asked, and that's how do therapists kind of either cope with or compartmentalize their day when they see multiple patients back to back? How do they do that? Because they hear a lot of a lot of stories and a lot of trauma often during the day. I say that we're very good at being able to compartmentalize. We can see clients and we can tune into what they're talking about and be very sympathetic, and it does affect us. I mean, it definitely does. But we're able to, switch gears and go on to the next one. But we do sometimes take it home with us too. And I think we have to work on our own coping skills of relaxation and doing positive things, because sometimes we are human.
Yeah, and I think this is something that we teach our clients, and we have to integrate that too into our daily schedule. So we use a lot of the techniques that we teaching our clients too, especially a lot of the for me, a lot of the meditation, mindfulness techniques, where you can really be in the moment with the client, with whatever they're dealing with, but then you're also able to kind of wrap it up and be fully present for the next person who's coming in. So whatever way that works for the therapist, it's important to integrate that self-care. A lot of times you hear about the compassion fatigue in people who work with individuals either on a mental health basis or on a medical basis, nurses, doctors. So what happens there is that it's almost like, you're constantly trying to fill a bucket of water and there's a hole in the bottom of the bucket. And so you can be putting out a lot of energy, but not getting replenished. So as a therapist, you have to fix the hole in the bucket. And you have to be able to, after each session, be able to replenish, and whether that is a quick run up and down the stairs because you only have 5 minutes, just a physical outlet, or a quick 5 deep breath diaphragmatic breathing practice, or something that is going to be able to let you move on without carrying all of the content of the issues that you've just talked about. So that's important, and it is a practice that makes a big difference in how effectively we do our work, and whether or not we experience that compassion fatigue. Any other thoughts on that?
No, I think that you said that very well. That's really what we do. We try to practice what we preach, basically.
Yeah. I did have a question. A few weeks ago we talked about personality disorders, and I have a question here. I'm asking that we redefine the clusters. There was a lot of information to talk about, but just to define that again, we have 3 clusters, A, B, and C. So there are 10 personality disorders, and the first cluster is A, the odd or the eccentric, which are the schizotypal, the paranoid, and the schizoid disorders. Cluster B, dramatic emotional. Those are the borderline, the histrionic, narcissistic, and the antisocial. And this cluster B is probably the cluster that gets the most attention because we tend to see a lot of criminal activities, a lot more drug use, DUIs, probation, because this is an attention-getting cluster. Compared to, cluster C, which is the anxious and fearful, where we're talking about the dependent and the avoidant and the obsessive compulsive. Those are the group that we tend not to see as much of because they are avoidant, and being able to even think of meeting with a therapist would be very, very difficult. So we see a lot less of those. And another one kind of like this too, or related to this, is how do we define a personality disorder? So it's an enduring pattern, right? It's a long term. It's not just a situation where we see these behaviors at the workplace. We want to see them at the workplace, at home, in the community, a lot of different places, right? And it's not just a one-time thing. It's consistent. Tends to start to develop in the teenage years. And what we are seeing there are issues either in thinking, right? The thinking tends to be very black and white, very rigid in structure, right? With feelings, tend to have really, really major issues with feelings such as anger, right? Feeling overwhelmed, severely depressed, where those emotions are just, we feel like we don't have any control over them. In interpersonal relationships, see a lot of history of all kinds of difficulties in relationships, and difficulties with impulse control. So, with the internet, it's very easy to go on and say, oh, well, I do that and that and that and that. I must have a personality disorder. But for almost all of these diagnoses, you can identify with a few of the things. So an important thing too is to remember that you have to meet the criteria for a lot of these, this list of issues. So it may say, avoidant personality, and it give you 7 or 8 things. You have to meet usually around 6 of them. So if you just meet 1 or 2, that doesn't mean that you fall into that category. So, and again, the pattern is very pervasive and inflexible, and it leads to some kind of impairment or distress, whether for the individual or for everyone involved with the individual. Okay. Any other questions?
A question I'm often asked is if a patient comes in with any kind of suicidal thoughts, will the therapist lock them up? I think that's a real fear patients have sometimes. The answer to that is probably not. When a patient comes in, I would encourage anyone who's having any kind of distressing thoughts, any kind of suicidal thoughts, or even just ideations, not necessarily plans, just thoughts, to come in and talk to someone. You're not going to get locked up for thoughts. That's not going to happen. What we're going to do is really try to help you, try to get you to a good place so that these thoughts are not there anymore. If someone is actively suicidal, we're not going to lock them up either. We're going to try to recommend that they get medical attention and get screened at a hospital so that they can be helped, and then take it from there. No one's going to get locked up. We're going to get them as much support medically as possible.
Right, right. Sometimes we could come up with a like a safety plan. Sometimes that can be helpful, where we'll work with the client to, for example, on a scale of 1 to 10, when you're thinking about it, what's your number on that scale? Oh, I'm at an 8 or 9, right? So how can we know that you're moving towards that direction? Oh, when I'm at a 5, right? And I'm starting to not go to an activity I usually go to, or I'm starting not to eat much, not to have an appetite. What are my early warning signs, right? Because then if I'm aware of my early warning signs, that's the time that I could perhaps someone could step in and slow that down, that we can intervene. What are my support systems, right? Just having a list of emergency numbers that are there, a list of things that I know I really typically enjoy, right? 5 things that I usually enjoy. So all of these are kind of like lifelines and support systems. But just spending the time to create something like that can help a little bit. Sometimes it can help a lot, right? So yeah, and I think every time, especially when we have a new person, we will always take their history of any prior suicidal ideation and prior suicide attempts to have that, so we know that, right? And encourage that communication where a client feels that they can talk about any thoughts. Because like we said, the earlier they can talk about it, if they can tell you when they're at a 4 rather than when they're at an 8, that can make a big difference. Yeah. So another question. Someone asked, we hear a lot about meditation nowadays, and what are the benefits? And there are a lot of benefits, and there's a ton of research that's looking at mindfulness-based stress reduction, mindfulness meditation, all kinds of different types of meditations, and are there any concrete research studies that look at that? And so although it's a very, very old technique, for a lot of people it's something that they don't know about, or it's relatively new. So research has found 3 main areas that without a doubt has been discovered that meditation is very helpful for. Number 1 is stress reduction. And we talked about this early on in our series about the Center for Mindfulness-Based Stress Reduction, which is at the University of Massachusetts Medical School. But it's being used, this approach is being used more and more in healthcare, and not just mental health care, but also medical health care, because it's been demonstrated that when people practice mindfulness-based stress reduction meditation on a regular basis, their ability to tolerate and cope with stress is really changed, and their ability to manage anxiety. And one of the things we talked about with stress was that, what's a stressor and how do we define it, and what's a stressor for you may not be for me, and vice versa. So the way we're looking at stress and managing the stress response, a person learning mindfulness meditation can really start to use that ability to look at it in a different way, frame it in a different way, and therefore their responses are different and much more manageable. Two is it's being used a lot in pain reduction. So a lot of pain clinics now, and the risk with the pain clinic obviously is that a client can become addicted to the pain meds, and that happens a lot. So using meditation for healing and recovery post-surgery, or with people who have chronic pain issues, that has also been found to, through a lot of research, to be very effective. And then thirdly, meditation has been proven to enhance a person's mental health abilities or skills. For example, bringing that into analytical thinking, being able to focus. A lot of times children and adults are diagnosed with ADHD, and which is a big focus issue. So meditation can teach a practitioner to be able to narrow their focus when they need it, and to broaden it when they need it. And that in a time when they need to narrow it because they're focusing on a particular problem or issue or person, that they can not get pulled away by the distractions, So it's been found to be very helpful in a lot of other areas as well. But just so much research has been done with stress, anxiety, depression, focus, thinking skills, problem solving, and healing and pain management. That's really where the focus has been.
Well, anxiety is the number one problem, really, that people come into therapy with.
Yeah.
So it's definitely a great benefit to them if they can employ that and learn that.
Yeah. There is something that's called HeartMath. HeartMath meditation is a great system. It helps an individual help themselves to regulate those limbic system, or those emotional responses. So what it looks at is what's called heart rate variability. It's the timing between, if you're thinking of an EKG, right, the slight differences in regularity between each heartbeat. Right, and the more variability there is, the healthier that person's autonomic nervous system is, and the less the variability, right, the more prone they are to have issues with major stress issues, anxiety, and depression. So this system uses a form of what's called biofeedback, where a person has a sensor on their ear or on their finger that records their heart rate, and then they have a screen. And at first, we may just talk about, the room and the pictures on the walls and basic things to get a baseline, right? Then we talk about, how are things going at work or in the family, and more stress-related things, and we can see in real time how the heart rate variability changes. So with the use of biofeedback, we can help the person immediately. We can immediately say, see, there's a shift here, right? Let's do a little bit of breathing, a little bit of release, muscle release, right? A little bit of relaxation that we are teaching them, and now see that that's gone back to a really great baseline. And so the idea is to be able to talk through these issues that would normally cause tension and anxiety in the body and in the mind, to be able to talk through them and still remain in a very calm way. A lot of times a client doesn't realize that they are already highly stressed, or they don't realize that their muscles are tense, right? So when you can give them immediate feedback with the screen, you can say, whatever you're doing right now is really good, because it's very you know, it looks where it should be, it looks close to a good baseline, they can say, oh, wow, I just took a nice long deep breath, or I just released my shoulders, or so I'm able to tune in to more subtle changes that I might not be aware of normally, so I can become better and better at regulating those. And normally with HeartMath, you know, 4 to 6 sessions, and then you can also have the app on your phone as well. So anytime you need to, you can, you know, sync with that as well. Okay. Any other questions that came in? I know there were a lot, but someone wanted a review of SMART goals that we talked about, because we used that acronym, SMART goals, and what they were. So the idea is to, when we're setting a goal, to make it as achievable as possible. So I want to set myself up for success, right? And I don't want to kind of say a quarter of the way through, this is way too difficult or not doable, and I'm giving up. So we want it to be specific, measurable, attainable, right? Am I the one who's going to be doing this? Is it dependent on someone at work or someone else? It's realistic or relevant, and time bound. So I'm going to start going to the gym, and I'm going to go for 45 minutes, 3 times a week, and at the end of 3 months, I hope to have lost 5 pounds, or I hope to have changed my body fat composition a little bit. So things like that, where more measurable and realistic. We're running out of time. So thank you for listening to Therapy Chat. If you have any questions about anything that we talked about today, or there's anything that you'd like us to discuss in the future, you can contact us at phoenixinfo.online, or you can call 508-623-3931. And thank you for joining us.
Thank you.